if you could redesign one part of NHS Access today through triage, entry point routing, which would have the biggest impact and why? But what I want you to do first, Nadia, is just introduce your background, because I'm aware that we haven't actually given anybody any information about you.
Sure. Thank you, Sharon. So hi, everyone. I'm Nadia Kuftinoff. I am the Digital Healthcare Transformation Lead for EBO. I previously worked in the NHS all over the place for nearly a decade. So I started off in a health innovation network. Then I moved to a mental health trust. Then I was at an integrated care board. And now I'm here. So to answer your question, Sharon, all of it is integral and as equally as important as one another. I think the question kind of needs to be flipped on its head and said, is the design process for any of those things what you ideally want it to be? So we need to ensure that any of those things are easy to use, useful, and are safe and fit for purpose and doing what they need to do. So it's really the redesign process that needs to be redesigned, I think, in a lot of places to ensure that interoperability is working as smoothly as it can, that the information that's available is current and up to date, that the safety features with the AI are spot on and they've been tried and tested. There's a lot that needs to go into every single one of these things, and I think the important thing to think of is don't forget anything in any of those steps. So when you go to a supermarket self-checkout, for example, if something goes wrong, like if there's a problem with the scanner, then you want the machine to be able to be fixed quickly. If you've got an issue, you want somebody to be able to come and help you quickly. If there's something that isn't recognized when you scan the barcode, you want there to be a directory that you can find things. So it's really anticipating, like, we have all of these things in place and we want to make sure that if somebody is looking for information, that information is available, that the technology is in place, so it makes it easier to just do things seamlessly and it works the first time as well. And if something goes wrong, that there is a fail safe, that they can be directed to somewhere where they can interact with a person who will get back to them and help. So it's all important, as long as it's simple, as long as it's branded in the right way, and we're adhering to NHS design principles at EBO, and that's a really great start. As long as there's integration where things make sense, so with the NHS app, that's also fantastic. You just want it to be simple and for it to work as intended. And if it doesn't, that it's not just going to explode and everything falls over, but there will be a way for a person who uses services, or a citizen or a carer, to be able to make their way to the final destination that they're hoping to reach with the technology.